In a second, please observe the picture on your screen and tell me in the comment section what you think about this couple. Thank you for your comments. Well, your thoughts may be same as mine. We will find out in the course of this video if we are thinking alike, okay? Welcome to Antenatal Faith Clinic. If you are seeing me for the first time, I am Nurse Z, and on this channel I bring you interesting topics that has to do with matters concerning women. If this sounds like what you love to hear, please click the subscribe button, hit our notification bell so you get notified each time I post in new videos. To my returning subscribers, I really appreciate. Thank you for staying glued to this channel. I don't take it for granted. Thank you so much for your support so far. Do you know that children born from an unwanted conception stand the risk of being born with low birth weight and also stand the risk of dying in their first year of life? And most times, because of unavailability of sufficient resources, they may suffer developmental problem as they grow. How about the mother? She stands the risk of having depression. She stands the risk of abuse both to herself. She even stands a risk of losing her marriage because her relationship with her spouse is at greater risk of dissolution. The couple may suffer economic hardship, which will make them not to achieve their educational and career goals in life. That is why on this video today, I want to address a very important topic: birth control. Family planning. What is family planning? Simply put, family planning is information, means and method that gives an individual the opportunity to decide when to have children. It is achieved through the use of contraceptive methods and treatment of infertility. So as a couple, before you begin family planning, you have to ask yourself these 3 questions. Number 1, when are you planning to have your first child? When do you plan to have the second child? The last question is this: when are we planning to stop? When are we ending this business? All these questions are answered with family planning. Before I go into the various methods of family planning, I want to share with us the little myths and misconceptions that people have about family planning that are not always true. One of those misconceptions is that when your partner withdraws immediately after ejaculation, you will not get pregnant. My dear, you will get pregnant because some sperm cell may still be present in the tip of the penis and you stand a chance of being pregnant. Another misconception is that emergency contraceptive is more effective in the morning. It's not true. As soon as you have an unprotected sexual contact with your partner, you take the emergency contraceptive immediately. It must not necessarily be in the morning, okay? Delay is dangerous. And note, emergency contraceptive is not abortion pill. If you're already pregnant, emergency contraceptive will not work. Another misconception is that you will not get pregnant when you are breastfeeding. Who says that? If you check, many unplanned pregnancy occur in the first few months of delivery, right? So, lactation amenorrhea method is not 100% efficient. When you are breastfeeding, you should have a backup method to avoid stories that touches the heart. Another funny misconception is that IUCD moves around the body when it started. It moves to the brain, it moves to the breast, it moves to one part of your body or the other. It is not true. When inserted, it remains where it is, except if it is not properly done, or in a situation where the size of your uterus is not appropriate for the IUCD, then you see that it will now dislodge or it will miss. This is what we call missing IUCD. Still within the uterus, not outside, or it will fall off. But in the case where it will start moving around your body, it is not true. Another misconception is why taking pills that it is good to take a break. My dear, take a break, and next month I'll receive you gladly at antenatal clinic. So then, what are the different methods of family planning? We have the barrier method, which include the condom, both the male and female condom. We have the short-acting hormonal contraceptive. This one is short-acting because it lasts for a short period of time, for a few weeks, a few months, a few days, and it includes the pills, the injectables. The next one is the long-acting hormonal contraceptive method. This one, they last for years. They are the IUCDs, they are the implants. They last for a long period of time. That's why it is called the long-lasting hormonal contraceptive method. The next method is the sterilization method or the permanent method. In this case, it is mostly done by couples who have gotten the number of children that they want, and then they have said bye-bye to this business of childbearing. It is a permanent method of family planning. The last method on my list is the fertility awareness method. In this case, the woman is aware of her body system. She's aware of her ovulation, her menstruation, her cycle, and then she calculates both her safe and her unsafe period to give her a guide as to when to have intercourse with her partner. It is called the fertility awareness method. Now, if you are considering using any of these birth control methods, you and your partner should ask yourself these questions. How readily available is this method to us? How does this method work? What are the do's and don'ts of this particular choosing method? How effective is it? What is the failure rate? Is this method reversible? Is this method a permanent one? Is this choosing method compatible with your religious belief, your cultural belief? All these questions you have to ask yourself. Is it convenient and affordable? What are the side effects of this method? Does it offer me any benefits? And of course, will it be acceptable to my partner? If you've successfully answered all these questions, then you are good to go without your choosing choice of family planning method. Now, let's look at the benefits of family planning. It prevents unintended pregnancy and also incidences of abortion that puts a woman's life at risk of death. Family planning has a dual function. It prevents pregnancy and also prevents you from contracting sexually transmitted diseases. Another benefit of family planning is that family planning empowers women. It empowers the couple with the right information to decide whether and when to have children. Women are better enabled to complete their education because of family planning. Women's autonomy within the household is increased and her earning power improved because of family planning. Family planning does more than save life. It also saves money. So, in our next video, we'll be picking these various methods one by one, dissecting them, and telling you all the information you need to know about each of these methods, including their advantage and disadvantage. So please, stay glued to this channel. If you are watching and you have not subscribed, don't hold the subscribe for too long. Please, subscribe to this channel. Hit our notification bell so you get notified anytime I post in new videos. Thank you for listening. See you next week. Bye-bye.